Think about this. 70% of my decisions as a physician, of physicians all across the United States and other providers, really start with a drop of blood. That raw, information-rich data is really the source code to uncovering hidden risk and monitoring chronic disease. The problem is that 30, 40, 50% of patients actually never get the blood that I prescribe or order. When I talk to you about out of sight, out of mind, once they leave my office with a lab rec, if they don't show up, if they never get their blood drawn, I'll never know. If you look at healthcare, we've got the best and the worst healthcare system in the world. It's siloed, it's impersonal, it's episodic, it's fragmented. So many adjectives you could use, but it's completely disconnected. Nuno and I came together to see that technology is the great enabler to bridge those gaps.
The whole idea of how phlebotomists and, in the outside world really interacts with our application. When you look at the marketplace from a provider perspective, there's always been a gap in the ability to collect real-time data from their patients in order to be able to manage them effectively. So how do you solve that problem? And that's what we created Iggbo to do.
Turn right onto Sunny Grove Road.
Nuno perceived the need. Nuno understood what was going on, and he knew that there was a problem in the distribution of labor and how labor was managed in that business. It was just, hey, this ought to be on demand. The labor cost here ought to be variable, not fixed. I mean, it just made perfect sense.
We block off the calendar from...
With the ease of an app, a phlebotomist can be dispatched anywhere, anytime to draw blood. Iggbo manages every step of the transaction, making it easy for patients and assuring the labs and the providers that the blood is getting drawn.
Hi Carly, this is Tamika with Iggbo.
It becomes a seamless act so that you can schedule it in a convenient way where you can go home and call a number or go into a web portal and just say, you know what, this is good for this day, this hour, and then someone just shows up at your home and does all the work and sends it out.
And now all of a sudden, the Iggbo network enables labs to have a larger footprint. It enables doctors the ability to order the right test at the right time without the administrative hassles of trying to figure out how am I going to remind my patients to get the blood drawn.
This class set up here, tested for you.
And then from the patient standpoint, what an amazing way to get reminders about the necessary blood work at the right time at the right place.
And package it up into the kit that your doctor needs.
The key to technology is not to get caught up in the technology itself. It's really to figure out how to use technology, on the underside of all of it, but really make it feel human.
Imagine a mom with a sick kid with a sore throat and a bad cold, not knowing if it's flu or strep, and thinking, do I go drive to the pediatrician's office and wait in line with 10 other sick kids and the time that takes? Or you know what? I can dispatch an Iggy to check my kid's sore throat for strep and do a flu swab and know in 8 minutes what's going on. And those results can be delivered to my pediatrician rapidly, quickly. That can happen today. That's happening today.
Hi.
Hey, I'm Deontay with Iggbo.
Coleman.
Nice to meet you, Coleman.
Nice to meet you too.
This is different because this gets right to taking care of people. This really democratizes service that really should be available to everybody. They're going to get better health care. We're just delivering a service against a critical piece of health care, which is just blood, the analysis of blood.
When you begin to look at the future and what Iggbo can do to bring better science, better convenience, better access to all of the patients that are out there, it's really amazing. We're just scratching the surface.